presentation?
Yeah, I am sharing. Can you see my screen?
Yes, sir.
Okay.
Yes, sir. Fine.
Okay, इसको मैं करता हूँ उस पे.
Sir, we are live now. With your all permission, we are beginning for the session today.
Okay, you start.
Good evening. This is Sahili from IJCP, and I would like to introduce the topic for today's discussion. And the topic of today's discussion is importance of vaccines in different specialties. And talk about this topic, we have a very enriched panel with us. Before handing it over to the panelists, I would like to introduce our moderator of today's session, and he is none other than Dr. Arun Sabda, sir. Now,
Hello.
I would like to hand over the session to sir for his proceedings. Sir, over to you.
Thank you. Thank you, Sahili, for the kind word. And first of all, I would like to thank you, IJCP and the METO for giving us the opportunity. So today is the National Immunization Day. So we have kept this program on this occasion. So first of all, we have the very dynamic and all panelists, the very learned panelists. First, I will introduce none other than Dr. Suresh Kumar. He is a director, professor, and medical director at LNJB Hospital and Maulana Medical College. And and his achievement received award from the Honorable Union Health Minister Shri Mansukh Mandviya ji, and the best government hospital combating the COVID in India. And he has successfully treated more than 25,000 COVID patients, highest in the India, single hospital of the COVID patient, and successfully treated more than 6,000 patients of the hepatitis C, received award and appreciation by the UN, United Nations, from the Assistant Secretary General and the UNPDP, and Regional Director of the Asia and the Pacific and Kenny Raja, and Delhi Vidhan Sabha State Award honor as the best corona doctor in Delhi and NCR, awarded by the Honorable Minister at the state level function at the DMC, and UNICEF appreciation and the ambassador in the vaccination, and published more than 94 research papers in international and the national journal, also written 2 books. Another panelist, none other than, she's a very renowned gynecologist, none other than the Dr. Meenakshi Ahuja. She is a senior director in Obs and Gynae, Fortis Law Femina in New Delhi, and obstetrician and the gynecologist, cosmetic gynecologist, and she is a president of the Indian Menopause Society, Delhi, and academic secretary of Delhi Gynae Forum, vice president of the South Delhi IMA, and member executive committee AOGD, and past president of the DGFS, and speaker at the FOXI and AO, FOX, and public forums, and passionate about the women's health and the disease prevention, secretary of the AOGD, breast cancer, cervical cancer awareness committee, and member quality improvement committee, AOGD, member and reproductive endocrinology in the FOXI. Another then very renowned pediatrician in Delhi, none other than Dr. Pravinder Singh Narang. He is known as the PS Narang, not the Pravinder Singh, PS Narang. He is the HOD and director of the pediatrics at Max Super Specialty Hospital in Delhi, MBBS from Maulana Medical College in 1974, and MRCP in pediatrics and Royal College of the London and Edinburgh and the Glasgow, and DCH London and DCH from Delhi, and FIAP, and he has more than 40 years experience in the pediatrics, editor of the 10 books, Child and its Health, both in English and Hindi, president of the IAP Delhi North Zone, and executive member of the IAP Infection Disease Chapter, and president of the Svera Rehabilitation Institute of the Child and with specific needs, and NGO serving children with the physical and the mental challenges, and regular contributor to the NTTV TV. He is a celebrity too, other than the doctors. So the cricket certificate institution in the All India Radio and the Delhi Doordarshan and the radio in Australia. So another panelist is none other than Dr. Nishinath Jha. He is a senior consultant physician at Fortis Hospital, Shalimar Bagh, and director Good Health Clinic, Shastri Nagar, Delhi, and vice president North Delhi Physician Forum, and former general secretary of the North Delhi Physician Forum. Now I will come to the topic. Today we are discussing about the importance of the vaccine. So dear friend, the World Health Organization says between 3.5 and 5 million deaths are prevented each year by the vaccination for preventable but life-threatening disease like the diphtheria, tetanus, pertussis, influenza, and measles, etc. Further, before going to our topic, I want to tell you something. What is the human life or the age? Human life and age is a cycle from birth to the death. That is the age. So to keep ourselves healthy and fit throughout the life, it is an art. If you don't know the art, then you cannot keep yourself healthy and fit. So health and fitness are the interrelated terms, and personal health, as per definition, a person, if the physically, mentally, socially, and spiritually is healthy, then we can say person is healthy. If person is healthy, then his or her immunity will be strong. If it is not healthy, the immunity will not be strong. So what are the sources which keeps our body fit, healthy, and tuned to the work, and keep our immunity strong? That is the food, carbohydrate, protein, fat, mineral, and vitamins. Everybody knows. Air, everybody knows the importance of oxygen, especially in the COVID era. And sleep, adequate sleep is required to keep ourselves fit and fine. And over and under both are the harmful sleep. So exercise and meditation, everybody knows these are very important to keep ourselves healthy. Another, water and fluids are also important to keep ourselves healthy. That's why we say there should be a electrolyte and fluid balance. So what is the difference between the vaccination and the immunization? Although they receive the life-saving antibodies from their mothers, however, these antibodies gradually diminish as the person grow, and which makes them susceptible to the infection and disease. Immunization forms a cushion that immunes them against the deadly infection by administration of the vaccination. So, who invented the vaccine? That is the Edinburgh Jenner was the first to test the method to protect against the smallpox in scientific manner. That's scientific manner. He did his study in 1796, and although he did not invent this method, he is often considered the father of the vaccine because of his scientific approach. He did the scientific approach that proved that the method worked. So what is the most successful vaccine all the time? That is smallpox. The last case, I think, observed in the 1975. After that, smallpox was not there. Vaccination with the vaccinia virus is the most famous example of the highly effective vaccine. And at the time when the people were faced with the smallpox outbreaks, the vaccine was associated with each of these characteristics that led to the implementation of successful vaccine. So what is the oldest vaccine? That is the in 1721, Lady Mary Wortley Mortley brought the smallpox inoculation to the Europe by asking her two daughters be inoculated against the smallpox, as she had observed practicing the Turkey. Dr. Edward Jenner created the world's first successful vaccine. He found out that the people infected with the cowpox were immune to the smallpox. So now the overview about the vaccine is over. Now I will come to the what are the current challenges in the vaccine. Current challenges facing in the vaccine development. One is the high and increasing cost of the vaccine development, that is around about more than 700 million to the $1 billion. And vaccines agitation and more stringent safety requirement and societal expectation. Everybody knows wants the 100% efficacy with the vaccine. It is not possible. So need to maintain the cold chain for the vaccine and increase the requirement for the single dose efficacy. So there are two types of immunity. Innate immunity is the immunity that is present from the birth. Acquired immunity is the immunity that is developed in individual after the exposure to the pathogen or throughout the vaccines. So these are acquired or the acquired immunity. It is of two types, natural and the artificial. In the natural, antigen enters in the body. Naturally, body induces the antibody and to the specific lymphocytes. Another the passive adaptive. The natural antibody passes from the mother to the fetus via the placenta or the to the infant via the mother's milk. And artificially, two types of their antigen are the introduced in the form of the vaccines in the body that produce the antibodies and specifically in the lymphocytes. And the passive performed antibodies in the immune serum are the introduced by the injection. So what is there's a relation between the nutrition, immunity, and the infection. Malnutrition will lead to the decreased immunity and infection, viral and the fungal and infection from any root of the body. So these are the a link between the nutrition and the immunity. If the nutrition is low, malnutrition, immunity will decrease. So similarly, this is the poor nutrition. These are the methods with the poor nutrition that will compromise the immune system and increase the risk of the infection. So first question to the Dr. P.S. Narang. So Dr. P.S. Narang, first question to you. Dr. P.S. Narang, being a
Yes.
senior pediatrician with a vast experience on the science of the vaccination in the age group of the newborn to the adolescents, what is your views about the vaccination?
Yeah.
Kindly share your experience and challenges. Child and the parent
Can you
perspective.
let me share my screen, please?
Yeah, I am stopping
as
my
if you-
screen.
Okay.
I am stopping my screen. Yes, you can share.
Okay, sir. First of all, you have made my, your presentation in the beginning is so good that you have already made my task quite easy. Today on the National Vaccination Day, 16th March, vaccines work for all, and let's join our hands and give vaccination. Sir, there are threats to global health. You also mentioned about these threats, but the three most important threats are following the global COVID and influenza pandemics, antimicrobial resistance, because no antimicrobial are coming and we will be faced with serious infection because there is not even a single antimicrobe which is in development.
डॉक्टर नारंग आपकी स्लाइडें नहीं आ रही
Sir, can you see my slides?
आपकी स्लाइड नहीं आ रही है
नहीं आ रही है it's
आ
there.
रही है
Yes, slide is
Okay.
visible, sir.
ओके मेरे
Okay.
एंगल पे कोई दिक्कत है
Okay, sir, vaccine hesitancy is one of the very important issue because we have many vaccine preventable vaccines which are still underused. So let's talk about this thing which you also mentioned about the WHO guideline for prevention of infection. We have our internal protection. We get this right from birth from maternal antibodies, and we need to carry on with our external protection by observing good hygiene, good potable water, and maintain this protection by vaccines. So this is the triad which you also discussed: the nutrient status, immunocompetence, and body's ability to fight infection. So this is there. If I say, beside the good hygiene, good potable water, vaccine are the best investment which can work in preventing infections. So today we are fortunate that we have 12 vaccine schedule in our national schedule. These are BCG, OPV, hepatitis B, the pentavalent vaccine, along with the PCV, along with Japanese encephalitis, measles and rubella, and DPT boosters and TD. Yes, this is quite good, these 12 vaccines, but it is not ideal because the IAP also recommends, beside this, these vaccines, which are The important vaccines such as hepatitis A, typhoid, chickenpox, meningococcal, cholera, pneumococcal, rabies, and yellow fever. These are recommended ages. There is a catch-up vaccination, and the catch-up vaccination is so important to remember those who haven't taken the vaccination, because during COVID time, in the last 2 years, there was a whole batch of children who were not even given vaccine. So for those, a catch-up vaccination was very important. So, and also to talk about specially vaccine in special situation, like vaccines for pneumococcal pneumonia, for people with comorbidity, and and old peoples. So when I talk about missed vaccination, things parents need to remember is to contradict the disease. Vaccines are necessary even if there is a delay in vaccination. It is important to catch up, and any vaccine, even if the boosters have been missed, can be given. If somebody has taken one vaccine and two are missing, he only needs two more. The one we have given, we have to remember that will still work up once we catch up the vaccination by giving the booster. So our aim should be from vaccine to vaccination. So I remember there was a lot of hesitancy for vaccines for cervical cancer in US, and uh, the slogan which was raised on the national was that all 10-year-old need vaccine for cervical cancer, Boostrix, and meningococcal. And the GP were told to say only one word: give me your arm, and used to give all the three vaccine to the adolescent and 10-year-old. So this is a type of schedule, because where patient comes to us, we explain them and they go back and then they don't come back. And quite a few times it is not possible, because when they come, they are already having a disease or fever. Then you need to counsel them for the next visit. So that is very important. And as Dr. Chabra pointed out, that to boost the immunity of an individual, not only the vaccination, keeping physically active, regular sleep habit, spending time with your loved one, and focusing on nutrition. So from there, I will give the mic back to you, sir. Immunization start in infancy and continue to adulthood. The best vaccination card I have seen is from UK, where the vaccination card says from birth till 65-year old. So their first vaccination card, which is given in the NHS, says from birth to 65, because this thing is still so prevalent, because patient comes to us at 1.5 year booster. Sir, ab vaccine khatam ho gaye, no more vaccine required. So you have to say that vaccines continue to be given because boosters are required, continue to be given in the adolescent, and continue to be given beyond 18 and beyond 18 to 65. So this immunization start in infancy, continue to adulthood, and adults need more protection, especially when they are old. So this will give me insight into what we need to do. And I will stop sharing my screen now.
Okay, okay. Dr. Narang, you have given very good. You have stopped, sir?
Yeah, I've stopped my sharing. Yeah, you can.
No. You are saying, okay. Thank you, Dr. Narang, for very good information about the vaccine in the child. So now I will come to the gynecologist before. The question to the Dr. Meenakshi Ahuja, Madam, being a competent obstetrician and the gynecologist, as per your expertise on the vaccination, both during the antenatal care and the adult vaccination, like the cervical cancer vaccine, and what challenges are you facing in specific group, in the ASC group as well as in the adult group, as per the cervical cancer? What are your views?
Thank you, Dr. Chabra, for the question, and thank you for having me here. You can understand that when we are talking about vaccinations, and like Dr. Narang said, that the most common problem is vaccine hesitancy in a group where, as children, parents are tuned to the fact that children need to get immunization done regularly. You can imagine that in a group where people are not tuned that they are coming and visiting a doctor for vaccination, how much the vaccine hesitancy is there. Be it in pregnancy, because in pregnancy, the fear that it may harm the mother and the child, women are not, very comfortable with the idea that they need vaccines. Thankfully, they know about tetanus, but to get the influenza vaccine in pregnancy also sometimes it becomes a challenge. It's only now, after so many years, I think, there's a timeline which is there in every vaccination. And now, thanks to a lot of things which I'll discuss later, that probably the hesitancy amongst patients has become less. Secondly, because these, as gynecologists, we are not tuned to giving vaccinations regularly. There is a lot of confusion unfortunately, amongst gynecologists ourselves. Like the HPV vaccination. Is it required only till 14? Can you take it till 26? Can women over 26 take it? Now, like the fact is that even boys can get the vaccine. So even the information and knowledge is not clear in all the gynecologists, and that's why there is a lot of confusion in that. We've been talking so much about vaccination, but I think in the busy schedule of gynecologists, they don't like to make it part of their schedule also. Of course, times are changing and we are facing less challenges in this. The third problem that I think all of us face is like the HPV vaccination has been there only for about 12, 13 years. And before that, it was not there. I think when we did our post-graduation, that's the time when the HPV virus was discovered. So you can imagine that all my contemporary doctors in other fields, be it an ophthalmologist, a physician, when you people were also doing MBBS with us, we were not even aware that there's something known as HPV and a vaccination. And unfortunately, sometimes when patients, I wouldn't say every time, but sometimes when patients visit us and we tell them, you must get your HPV or the cervical cancer vaccination done. When they visit doctors from other specialties who may be a family friend or otherwise, they will say, "Arey nahi, kya fayda koi injection lagane ka, unnecessarily koi zarurat nahi hai lagane ki." So that's the other challenge that as gynecologists we face. And that's why I think the information has to be percolated not only amongst general physicians, but also amongst, ENT specialists. Because at the end of the day, every doctor is informed. Any person can be a family doctor, be it a surgeon or, someone the patient confides in or has confidence in. So that information, unfortunately, is lacking, and that's why there's a lot of hesitancy. I think the most common vaccines that we now at least we are giving regularly is with the DPT as well as, or the Boostrix during pregnancy with the tetanus, TB, and the influenza vaccine in pregnancy is the HPV vaccination. So the HPV vaccination has various different guidelines, but actually in the Indian scenario, it can be given up to even 45 years of age, because the point to understand is that it's one of probably the only vaccine in the world which is effective against cancer. And at the end of the day, it is effective against the second most common cancer in women. And I would say that, people say that, okay, if you're sexually active, you may not need the vaccine now. But the point is that you may not get the complete 99.5% protection. But even if you're getting 90% protection, it's good enough. The HPV vaccine is probably one of the most robust vaccines and prevents not only cervical cancer, but also other anogenital as well as oropharyngeal cancers. And I think the passion is very important amongst gynecologists, that they, talk about it to their patients, and they percolate the message that even if your girls have not received it with the pediatrician when they were young, it's still not too late. And like Dr. Narang pointed out, that the vaccines can be given even later. We don't have to think that only pediatricians have to give the vaccine. It is only now, when, in the last 10 years, that media has been talking about vaccinations. Like pediatricians also talk in the clinics, and they tell the mothers also of newborns. Sometimes I think Dr. Narang will agree that a lot of pediatricians are giving vaccinations even to the mothers, because their gynecologists have not talked about it. which is actually at the end of the day quite shameful, because the gynecologist should be taking it upon her responsibility to vaccinate every woman. And I guess now information is percolating all over, and of course the mass hysteria which happened when Poonam Pandey died and was resurrected. I think people started talking about the cervical cancer and the HPV vaccination. And we all, I think, saw that. I mean, I thought it was a very bad trick to play for personal publicity. But at the end of the day, it did get people aware. And people do come and ask that, okay, so many times I have to tell my patients and their husbands just in jest, कि अपनी बीवी का इंजेक्शन लगवा दो, वो तो पूनम पांडे भी मर के जिंदा हो गई सर्वाइकल कैंसर से, तो तुम इंजेक्शन तो लगवा लो. So probably you don't know what works when, but at the end of the day, if information is available to gynecologists, to other specialties, to the public, I think wholeheartedly only then we will be able to overcome all these challenges.
डॉक्टर मीनाक्षी ने बहुत अच्छा बताया. डॉक्टर मीनाक्षी, I will ask you two questions. TT vaccines, you give the how many doses in the pregnancy?
So now the recommendation is 2 vaccines in pregnancy about the tetanus. So instead of giving the TT, we are giving TD.
Okay.
And 4 to 6 weeks later, we give the Tdap.
Okay.
We like to give the Tdap around 28 weeks of pregnancy.
Okay.
Because then the mother is also protected and the neonate is protected from Tdap. Because Dr. Narang will agree that the first vaccination to the baby for pertussis and diphtheria will be given only at 6 weeks of delivery, and the baby is protected even then. So ideally, everyone has their own protocol. The protocol that I follow is that around 20 weeks, I give the influenza vaccine, 24, I give the TD, and 28 weeks, I finish with the Tdap, so that the woman is protected by 28 weeks and the newborn also gets complete.
What about the influenza virus? Which trimester you give the influenza vaccines?
So influenza vaccine can actually be given in any trimester, but currently the FOXI guidelines say that we should give it in the 2nd or the 3rd trimester unless there's a sudden epidemic. So normally I'm giving it just for the sake that I remember. I give it to all my patients at the 20 weeks with the 20 week scan.
Okay. So next question, very good. You have given a very informative information about the vaccines in the pregnancy. So next question, my question to Dr. Suresh. Just एक minute. Next question to Dr. Suresh. Being a director, professor of the medicine of the big institute like the Maulana Azad Medical College, and you have worked a lot on the in your introduction, COVID-19 vaccination, both in the preparatory and the launch phases. And what were the specific issues have you come across, and how did you resolve these issues? Over to Dr. Suresh, please. Dr. Suresh? Dr. Suresh? Dr. Suresh?
I think cut off हो गया.
Hello.
हाँ जी, Dr. Suresh.
Thank you for inviting me for this esteemed panel. And it's a wonderful panel discussion. I was hearing about the view of pediatrician and gynecologist. And during COVID, it was big challenge and the COVID vaccination journey was very difficult.
Suresh, Dr. Suresh, I think disconnected. We should go to another question, I think. Till he comes back.
I think once he has a better connection, he can join in. Meanwhile, we can continue with the questions.
I take the Dr. Jha. Dr. Jha.
Yeah.
डॉक्टर झा
Yes, sir.
एक मिनट बस आपका क्वेश्चन कहाँ गया ये बड़ी दिक्कत होती है जब कनेक्शन टूट जाते हैं ना डॉक्टर झा बीइंग ए सीनियर मेडिकल स्पेशलिस्ट your experience of the adult vaccination like hepatitis B, rabies and influenza and kindly enlighten us about the use, efficacy, safety and side effect of these vaccines. So over to Dr. Jha.
Thank you, Dr. Chawla and I see JP for giving the opportunity to interact with such a esteemed panelist. Adult immunization, as you know, is a late feature. We used to have immunization means the children or maybe the pregnant ladies. But now adult immunization has come in a big way. And these are diseases you said. I will go one by one about the diseases like rabies. There are a lot of misconceptions about the rabies. So when to give, how to give, you will know we have two types of rabies vaccines. Human deployed cell vaccine and preferred tick employer vaccine. Both are effective with little side effects, like in all the vaccines, like pain at the injection site, sometimes bit reactions, body ache, these things are there. They're very safe effective. So there are two types of rabies vaccination can be done. One is pre-exposure. Pre-exposure is not recommended for all the people. Pre-exposure recommended only for the veterinarians, lab workers, dog catchers, somebody who is involved in the upkeep or you people upkeep of the animals. So they are for the pre-exposure is given, and for pre-exposure we have to give only 3 doses. That is 0, 7, and 20. So 3 doses very clear for the pre-exposure. Somebody who is exposed to the animals. Post-exposure is we all know 5 injections are a must. That is 0, 3, 7, 14, and 30. And if required, one booster can be at the 90 days. That is the normal procedure. Then one question frequently people ask, डॉक्टर हमने अभी तो लिया था इंजेक्शन अभी और लेना अभी काट लिया अब क्या करें? There is always when there is a re-exposure, one has to give at least 2 vaccines. Again, one has to take every re-exposure. That is on 0 and 3 days. That's a must. So that is about the rabies. I will give just a practical aspect. So these are the things. If the injury is severe, then of course we use the immunoglobulins also. But as far as vaccine is concerned, pre-exposure, post-exposure is there. About the hepatitis B, we all know hepatitis B is an infection one can be fatal as acute hepatic failure or may lead to cirrhosis, it may lead to chronic liver failure, ultimately to the death and a very debilitating disease is the chronic liver disease. So hepatitis B, if somebody is not vaccinated, in the children we give 3 doses, we all know 0, 1 and 6 months. And in the somebody in the adult is not vaccinated, all 3 doses can be given at 0, 1, 6. And hepatitis B is to be given if somebody exposed in the high risk individuals, like somebody exposed to the percutaneous or mucosal exposure to the infected persons, sexual workers who are sexually active was exposed to the hepatitis B person, IV drug users, then very chronic conditions like we know in CKD, CLD, somebody is on the suffering from cancer or somebody is immunocompromised because of the diseases, or they are on the anti-cancer drugs or immunosuppressant drugs. So that is the time one has to give hepatitis B vaccine in the high risk individuals. Routinely should not be given. If it is exposed earlier, it is well and good. There is no post-exposure vaccination is there. That it has to be very, very clear. There is no post-exposure vaccination is required. And about the influenza, we all know influenza vaccine is very, very important for the adult users. And as Madam Meenakshi said, in the pregnancy also used at the 20 to 26 weeks influenza. So influenza, the problem is that it is a killed virus vaccine and is effective after 2 weeks of the injection or the vaccination we did. It is given to the high risk individuals or any person who is more than 50 years of age, more than 50 years, that can be given the influenza vaccine. But the problem with the influenza vaccine is that it is influenza virus mutates very frequently. So it has to be given every year because with the new mutant virus. So that is the one thing. Every year one has to do influenza. In high risk individuals like COPD, CKD, CAD, diabetes, immunocompromised persons, has to be, or somebody is suffering from pregnancy, they have to give an influenza vaccine every year or before. That is about the influenza. It's a killed virus vaccine, very effective. And the one pneumococcal, I think Dr. Chawla missed this thing. Pneumococcal is also very important. There are two types of pneumococcal vaccine. One is polysaccharide, which contains 23 serotypes. That is called PPSD 30, 23, 23. And second is conjugated vaccine. That is very, very important. That contains 13 serotypes. But the polysaccharide with 23 serotypes, they are very less immunogenic. So chances of infection is more if you give the vaccination. It is given subsequently, can be given. About this conjugated vaccine, it is less immunogenic, very effective. It's a lifetime immunity is there for that pneumonitis. So pneumococcal infection, that is thing. And it is recommended for any person who is more than 65 years of age, and in, of course, in the risk high risk cases, like I told you, CLD, CKD, or CAD, diabetes, on immunosuppressants, somebody suffering from malignancy, these are the things can be given. So in the nutshell, these are the common, and a new vaccine has come, that is for the Herpes zoster or the shingles. The shingles has come, though it is costly, around about 10,000 per dose, but it is very effective. Though normal herpes zoster is not a life-threatening disease. So what we do is, morbidity is very high, like pain post neuralgia is very, very severe and people are very troublesome. So this vaccine can be used. Presently is marketed by GSK, and it is slightly costly. I think in the time it becomes so can be used frequently by the individual in part of the nation. Then others are varicella or these things or typhoid. These are also being done on specific cases. Normally varicella is given the somebody who is not taken vaccinated, not infected, that can take the varicella. There are a lot of vaccines are there, but I stop my deliberation at the moment.
Thank you, Dr. Jha. Very enlightening. You had told about the pneumococcal. Nowadays, people are giving the pneumococcal vaccine in each and every patient in the ICU. Is it fair to give, or should be given to the high risk patient? One question to you only.
Not in somebody who is in ICU has to be a high risk patient. There is no
High
doubt
risk,
about
yes.
it.
It is right. Now, Dr. Suresh has joined. Dr. Suresh, complete your answer.
So we were discussing the COVID hesitancy during pandemic. Initially, it was a big challenge, but successfully we did 1 lakh COVID vaccine at MEMC, highest in the national capital. And United Nations team came to our center to congratulate our team. So this is true for all the vaccines, whether it is a influenza vaccine or a pneumococcal vaccine. Most of the adult population thinks that they are healthy, they are not requiring any vaccine until unless the doctor motivates them, or there is a strong advocacy. As the point was made in the beginning, that until unless we have enough vaccine, but we have to vaccinate the population. We have seen that a lot of doctors, even we have a special drive for a meningococcal vaccine to have it in our center, Loknayak Hospital. And you will surprise that only 20% of our resident population were willing to take the vaccine. 80% just refused that why we require vaccine. There is no need of meningococcal vaccine. So they have a lot of issues, safety issues, and the efficacy issues, and the side effects. Particularly the 1 in 1,000 may have some adverse reaction or some allergic reaction that is there. But if you talk about the general population, particularly adult population, most of the adult population, they are not willing to take vaccine. They just say, "अरे vaccine तो बच्चों में लगती है, adults में भी क्या vaccine लगती है?" Because now Honorable Prime Minister also is giving more emphasis on the adult vaccination, particularly the cancer vaccines, SP vaccines, and the adolescent vaccines. But as it is rightly pointed out that all high risk group, particularly those patients who have COPD, bronchitis, asthma, and CKD patients, chronic alcoholic patients, they definitely require vaccines. And we have seen that large number of patients, we can prevent a lot of premature deaths. We have seen that 25% to 33% of all deaths in India is because of infectious disease. We know that majority of deaths now, the coronary artery disease and the other non-communicable disease have taken the lead, but still the infectious disease counts for around 30 to 35% of all deaths. These deaths can be prevented by very effective, very robust immunization program of the country. And it, as was earlier pointed out, that we must have a vaccine card up to the age of 65. That is a brilliant idea. The NHS is already adopting this, and our country is nowadays focusing more and more on the adult vaccines. And this is, I think, a beginning, and the community and all the NGOs of the major hospitals must have vaccinate group, high group, and we've seen that large proportion nowadays we have mentioned before is admitted COVID. So they have their questions. And timely vaccination, then because viral infection, COVID and influenza, COVID and tuberculosis, COVID and other comorbidities, and the death is very, very high in this high-risk population. So this is very important. You have taken a very good topic that adult immunization need to be more and more at the forefront, and we must all, as a doctors, whether you're a pediatrician or a physician or a gynecologist, we must adopt the vaccination strategy for the nation. Thank you.
Thank you, Dr. Suresh. You have given a very insight about the adult vaccination, especially in the vaccination. You did a very wonderful, commendable job during the COVID, especially in the vaccination, as per your statement. So next question to Dr. P.S. Narang. In what possible ways the parents can be energized and motivated for the vaccination, especially if the vaccination is injectable? Orally, everybody can take, but the injectable, it is very big problem for the parents and the children. How do you motivate them? Dr.
Can I share the screen again, please?
Why not? Why not? I have stopped screen.
Okay. Sir, your question is so good, so important, that injectable vaccines. Now, the way it has to be addressed, that is by formulating that either by a brand, like for the herpes zoster vaccine, Amitabh Bachchan has come forward to do it. Or I say to my patient that I have given it to my kids, I have taken it myself, I have taken vaccine for herpes zoster as well. And this special slide that you need vaccine throughout your life is important. Fortunately, some vaccines can be given orally, but some vaccine can only be given by injectable. And as Dr. Suresh pointed out, Dr. Jha pointed out, there are very, very few side effects one has to worry. I must say, sir, I took COVID vaccine within the first week when it was launched in India. And we went to take the vaccine and people started asking, sir, sab kuch theek hai na? Kuch hua to nahi? They were not worried about the benefit of the vaccine. They were worried about the side effect of the vaccine. For that, you need to develop, you need to give the stats. Now, today, if I say in England, We give 3 pneumococcal vaccine to our children with a booster at 1.5 year. In UK, when they have achieved the coverage of 95%, they have reduced it to only 2 doses, 1+1. They have reduced the doses of HPV to 1 per individual, but the coverage has to be 95%. And such a commendable thing will only come if ENT doctor, adult doctor, physician, and everybody comes around. Now, if I uh, go to the next slide, you have to tell that there are so much of stress, smoking, pollution, chronic diseases, and you know, people die of a chronic heart disease. But the precipitating factor
डॉक्टर
may
नारंग
be the
इसको
influence.
डॉक्टर फुल स्क्रीन पे कर लो, अपनी फुल स्क्रीन पे करिए स्लाइड.
Okay, कर दी. Sir,
Yes, good.
basically, people die of a chronic heart disease, chronic lung disease. But remember, sir, the precipitating factor can be a common flu. The precipitating factor may be influenza, and after that develop secondary infection, after that develop stress ulcer and so many things. So one has to come that to protect against disease, especially you are more vulnerable with your age, and you need to boost the effectiveness of the vaccine again and to lower the risk of chronic diseases. And the benefit of the newer vaccine can also be given. And travel vaccine, I think, is one of the best answer when it is come to travel. Dr. Suresh was pointing out meningococcal 20% coverage. But when somebody has traveled to Hajj, when somebody has to travel to US, they take meningococcal vaccine because it's a compulsory. There are only 2 countries in the world, the Nordic countries, which are making vaccine compulsory, not even UK and US. But yes, to protect against travel related diseases, they take hepatitis A, they take meningococcal, they take COVID vaccine and all those things. So friend, don't skip immunization. And one thing more, this is the adult vaccination. Herpes zoster, measles, mumps, rubella, chickenpox, and meningococcal. So talk to your healthcare professional. And this is another slide which I always tell to the whole family. And this is called cocoon theory. Cocoon theory is that if all adults in the family are protected, then the child who is less than 3 months old, even if he hasn't taken his vaccination or yet to start his vaccination, then he will be protected because nobody is giving him the infection. So cocoon theory says the vulnerable people in our house, if it's somebody is on a chemotherapy, if somebody is a chronic disease, then all the family members who are healthy must take influenza vaccine, must take pertussis boosters, and must take other vaccine which are communicable. And another pointer is that all those who are chronic may get less protection from the disease, but even some protection they get is more important, because we know in chronic renal condition we double the dose of hepatitis B, influenza also we double the dose. So my last slide, there is a drop of water on this leaf, and this drop of water on this leaf is balanced by the public, balanced by the government, balanced by the doctor and the patient. Any 3 ants which move back unproportionately, this water drop will fall down. And we need a cooperation not only of all doctors, we need a cooperation of public, we need a cooperation of patient, and we need a cooperation of government to combat any infection on this earth. And especially when we don't have any antimicrobial coming, sir, it is very important that we must do good hygiene, good potable water, and good vaccine strategy to balance this. And I'm thankful if our government is now initiating adult vaccination, because whenever I used to give lecture on adult vaccine, I used to say it start with tetanus ends with tetanus. But now, look back, it is with pneumococcal influenza, DPT, herpes zoster, MMR, human papilloma, chickenpox A, B, and meningococcal. Whether you take it by your will or by a brand ambassador or because of your comorbid condition, I think all the health professional must talk about vaccination to the population. And this is, in nutshell, about how to drive. And Dr. Minakshi, you just mentioned about that pediatrician sometimes give vaccine to the mothers. Uh, we definitely respect that the patients are with everybody, but when I say that it is the opportunity to vaccinate, when they are ready, if you are able to convince them, then we must vaccinate them. And
exactly my point. My point was exactly that we are failing in our duty as gynecologists. If the pediatricians can take out time to speak to the mother also about the importance of a vaccination. So I didn't say the pediatricians are being opportunistic. What I was saying is gynecologists, we are lacking in our responsibility. I'm very happy that the patient gets vaccinated wherever, but we are lacking in our duty. We don't talk about it.
now, I have done the advanced course in the vaccinology, and we have represented on various platforms in the pedicons. So people have started calling us, instead of a pediatrician, vaccinologist.
Thank you, Dr. Narang. I think you have motivated doctors too. Not only the parents and child, but by doctor too. You are motivated. You are very, very motivated. So thank you, Dr. Narang. And now I will ask the next question to Dr. Minakshi Ahuja. Madam, as you are aware of that the government is thinking of HPC, vaccination cervical cancer, as a national program. We will appreciate to have your views about this vaccine. What are your views about this vaccine?
So I think probably Dr. Chabra, it's the best thing which could have happened. Let me be very clear, because if the government talks about a vaccination, at least everyone, especially post-COVID, where people have understood that a national program on immunization of a particular disease, A, it gets awareness, B, the government is giving the vaccination, so, children all over get the benefit. More importantly, other people talk about it at least. So, it's not only the government cannot, obviously, in our Indian scenario, considering that it's not a sudden life-threatening emergency like COVID was, they cannot afford to vaccinate everyone. So they've picked up this group, which is the 14-year-olds or class 6 girls in government schools and in other schools where the children will be getting vaccinated. The vaccine is, of course, not available only for 14-year-olds. It's available actually, as the WHO says, from 9 to 45 years of age. So when the government is giving the vaccine to 14-year-olds free of cost or whatever, or at a subsidized cost, at least the other age groups also become, they understand the importance of the vaccine, and at least they will be visiting their pediatrician or their gynecologist or their GP and discussing whether they are also eligible for the vaccine and getting the vaccine. So any conversation about the vaccine is very important. Secondly, this is a strategy which was followed with the original HPV vaccine from MSD in Australia, where all school children who were about 14-year-olds were vaccinated. This has been done for the last 10, 12 years. And believe you me, HPV or cervical cancer has been eradicated from Australia. It is the first country in the world which has become HPV free, only because of this strategy. But there they were vaccinating not only the girls, but also the boys. So there is definitely a lot of merit. And probably that is also one big conversation starter for all of us. So when the government talks about it, patients talk about it, the media talks about it, and that's how the awareness grows. So I'm very, very happy about this step that our finance minister has taken this time.
Thank you, Dr. Minakshi. Next question. To Dr. Suresh, what is the current status of the COVID vaccines? What is your opinion about the Indian and the global guidelines for the booster dose of this vaccine? Dr. Suresh, please.
Sir, regarding COVID, you know that now the number of cases of COVID with the new variant, every time we have after 6 months, we have the new variant. This time also we have the jail variant.
Poor connection.
So,
डॉक्टर सुरेश आप मोबाइल पे ज्वाइन कर लीजिए ना
6 to 9 months. Hello.
मोबाइल
Sir, your voice is breaking.
Oh, sorry, because it's I was so some okay. Hello. Hello.
Yes, sir, now you're audible.
Hello. Now the current recommendation is that those patients who are elderly, who have COPD, who have cancer patients, C patients, these patients must be vaccinated. And this group, it is recommended.
So what you want to say is that it is still recommended for the immunocompromised patients, and boosters will definitely boost up the immunity, because even with influenza, when the strain doesn't change, we still give it.
Yes. Yes. 90% vaccine.
सर डॉक्टर छाबड़ा आपका म्यूट म्यूट है, आप म्यूट हो.
डॉक्टर सुरेश आर यू हियरिंग मी
बहुत
हाँ तो गए हैं सुरेश
सिग्नल बहुत पुअर है उनका.
उनका पोर सुरेश है. तो आई थिंक डॉक्टर झा से पूछते हैं अगला क्वेश्चन.
कोविड-19 के बारे में आई वांट टू से समथिंग.
एक मिनट डॉक्टर झा, एक बार डॉक्टर सुरेश को बोलने दो, उसके बाद आपसे पूछेंगे. उनको आने दो, जब तक आप अपना क्वेश्चन बताइए.
चलो मेरा क्वेश्चन दो आप. मेरा कोविड-19 पूछ रहा.
अभी देता हूँ. नेक्स्ट क्वेश्चन टू यू. Can you tell us the latest update on the vaccine against the malaria and the dengue?
Yes, latest updates I can tell you. These are the very most common disease, malaria and dengue in our country. But unfortunately, we don't have any vaccine for that approved at the moment. As far as malaria is concerned, the WHO has approved one malaria vaccine in December 2023. But because it is not approved in India and not using that malaria vaccine, that is for R21/Matrix-M, that has been approved by the WHO. But because I think lower turnout or lower number of vaccines available, it is being given in the high burden areas like some countries in Africa. So in India, it may come out when the situation improves, this vaccine. And this vaccination is for the falciparum malaria. And falciparum malaria, earlier it was very fatal and very common, not in Delhi, but in the northeastern countries, it was very, very common. In Bihar, I also seen good number of falciparum cases, which may be fatal. So that was there. सर बोल मैं रहा हूँ, फोटो आपका आ रहा है.
क्या जी?
बोल मैं रहा हूँ, फोटो आपकी आ रही है.
नहीं, आपकी भी आ रही है.
ये नाइंसाफी है सर. ये
जी
फोटो मेरी आ रही है, नाइंसाफी है आपकी.
सबकी आ रही है फोटो भाई.
So falciparum malaria in India it is reducing. So that is being given at the high burden areas in Africa. So that is about the malaria. And in near future, maybe it has contains 3 doses of vaccine. In near future, we expect by the end of the year, it will come to India also, malaria vaccine for falciparum species. About the dengue, for dengue, there's a vaccine was difficult to manufacture these vaccines or develop this vaccine because there are 4 subtypes. dengue 1, 2, 3, 4. So that becomes difficult to cover all the 4. But still, there is a one vaccine,
In the
dengue
pipeline, I
vaccine,
think.
approved in 2015, and it is approved in only 3 countries. That is Philippines, Brazil, and Mexico.
Okay. I think they till
India,
date
it
there
is
is
not
no
approved.
vaccine
There's a
about
process
the
of
malaria and
development.
the dengue, I think.
From 2024, they are going to be phase 3 trial by the famous COVID expert Nivita Datta for this phase 3 trials. And after that, we expect by the end of this year or early next year, we can have the dengue vaccine also. That will also contain 3 doses. So that is the latest status. Presently not, but we are expecting in very near future these 2 vaccines.
डॉक्टर मीनाक्षी, आपको जाना है, आपसे एक क्वेश्चन पूछूंगा क्योंकि आपका एक ऐसे डॉक्टर मदान दिल्ली से पूछ रहे हैं, कैन द सर्वाइकल वैक्सीन कैन बी गिवन इन द प्रेगनेंसी? Unmute yourself.
Yes.
Unmute.
So the cervical or the HPV vaccine is not currently being given in pregnancy. So although it's not a live vaccine, we don't give it in pregnancy, but for anyone who's planning a pregnancy, it can be given. And once, so there are 3 doses, 0, 2, and 6 months. So after the first dose, if someone becomes pregnant, the second and third dose can be given after delivery. So if someone's planning a pregnancy or infertility, it does not mean that she can't take the vaccine at that time. Anytime, like Dr. Narang said, that it's an opportunistic moment. Anytime a patient comes to us, we can give her the vaccine and reassure her that the vaccine doesn't get wasted. The remaining doses can be given after delivery. However, if someone takes the vaccine and becomes pregnant in that month, there is no indication for terminating the pregnancy. She can comfortably continue the pregnancy.
Okay.
I've got one question, Dr.
One
Meenakshi.
question, डॉक्टर जहाँ एक मिनट डॉक्टर ये उन्होंने जाना है, एक डॉक्टर सुबेंदु है कोलकाता से, उन्होंने पूछा है डॉक्टर मीनाक्षी से, hepatitis B vaccine can be given in the pregnancy first, second, third trimester?
Absolutely.
Okay.
It can be given in all the 3 trimesters.
Now, madam, you can go. You have to go.
Thank you, sir.
You can go.
Thank you, sir. Thank you.
Now,
Thank
Dr. Jha and Dr.
I've
Narang.
got one question, Dr. Meenakshi.
Dr. Meenakshi है. Dr. Meenakshi, Dr.
हाँ
Jha
जी.
से पूछेंगे.
मेरा भी एक
हाँ
question
जी, हाँ
सुन लो.
हाँ जी.
You have recommended for the young boys also. So what is the criteria? How do you select the boys for this vaccination, HPV vaccine?
See, the HPV is sexually transmitted. So ideally, any boy can get it. Currently, the recommendations in India say that if the boys are less than 16 years of age, the new vaccine, that is the HPV 9, which is available, can be given to boys between 9 and 15 years of age. However, if an adult male asks for the vaccine, and frankly, if my patient turns out to be HPV positive when I do a pap smear and I'm treating her for it, I will always give the partner the vaccine. So it's a safe vaccine. The guidelines are just there to help us that, okay, this is a group which needs it most, but off the counter or off the label vaccine can be comfortably given if any adult male asks for the vaccine. Like I said, in Australia, the boys and girls were both vaccinated because there's a risk of penile cancers, other genital cancers, oropharyngeal cancers, of genital warts. And also there's a male-to-male transmission among homosexuals. So it's not only, that it can be transmitted only from males to females or otherwise. It is also that we need to keep that in consideration. And that is why males, the guideline is, of course, the vaccine says clearly 9 to 15 years, all boys should be vaccinated. But after that, if any male is asking for a vaccine, or if I have a 24-year-old girl who's coming and their mother gets, and she says, I have a son who's 18-year-old, he's not got the vaccine. Can I vaccinate him also? Of course, definitely. It is just protection. There's no harm and suddenly nothing is going to come out wrong of it. I hope, Dr. Narang, I'm okay in saying that.
You are okay with that, but your point of when you raise the point of a homosexual, ma'am, I want to put one thing more is, if I'm given a choice to vaccinate boy or a girl, I think vaccinating boy is more important because the vice versa infection is more common. Boys do not get, see this HPV, there is one thing, the natural infection is not immunoprotective. The natural infection is not immunoprotective. Only vaccine gives you immunity. So
Absolutely.
even after the natural infection, the chances of getting same virus infection in males is more than in females. So HPV vaccine is very, very important. When you say above 15, now we have HPV4 by the name of Cervac, which is which can be given from 9 to 45 for both. And if I have to say the additional five viruses which are present in HPV9 beside HPV4, these five are very, very more important for females, because out of the 33,000 infections which they prevent, for the anogenital warts and for penile cancer, the first four are enough. I'm not saying if I'm given a choice of vaccinating HPV9 versus HPV4 till 45, which is a practical situation in most other countries abroad with the same vaccine, I will use HPV9. But giving HPV4 for boys instead of HPV9 beyond 15 years, I will still choose that because it is permissible in the product insert. And as far as I don't do anything off label, whatever is written in the product insert, I follow that. So if the product insert says till 26, I will use HPV4 beyond that. So of course, I mean, as you said, no harm will come because the same vaccine in US, UK, Australia is used for 45. It's only our country hasn't licensed it that. But vaccinating boys is far more important. And you have to tell parents that natural infections are not immunoprotective. Only vaccine can give you good protection.
Very good. Thank you, Dr. Narang. Dr. Narang, one question is from Dr. Mahesh from Delhi. After the giving the dose of the DPT and child gets injured in day-to-day practice, should he give the TT injection?
No, no, sir. This is absolutely, you have to follow the schedule.
Yeah.
Now, I will give a practical situation. When I give the primary 3 doses and I complete the primary 3 doses, I tell them that I've given you the 3 doses till 18 months of age. You do not require tetanus for additional injuries. Okay. When I give it 18 months, I tell 4.5. When I give it 4.5, I tell till 10. And at 10, if you have given DTaP, the DTaP, then another 10 years, you don't need to give. You need to care about the wound always. You need to give a good hygiene to the wound, good antiseptic to the wound. But no additional tetanus is required if the patient is already immune. If you are given till 5, till another 5 years, no.
Okay.
And additional, if you give a lot of TT, you get a lot of arthros reaction in your arm.
Okay. Thank you. Thank you, Dr. Narang. Now, what is the, I will take the take-home message from you and Dr. Jha, Dr. Suresh and Dr. Meenakshi are left. And what is your take-home message, Dr. Narang, about the immunization or the vaccine?
Sir, my take-home message is, I tell you, when I started working in the bone marrow unit, okay, although I have taken all the vaccine, but the bone marrow unit does not allow you to work till you have a sufficient titer of that protection, either by your natural disease or by the vaccination. Because that thing is that you are there not to give infection to others, whether it is your patient or it is anybody in your vicinity. And at the same time, you are not to receive any infection. So maintain your own vaccination status. I take influenza. I have taken the DTaP. I have taken the human papilloma, the herpes zoster vaccine. Of course, I'm over the age of HPV vaccine now. So all those things are important. My take-home message is that you become a role model for your patient, and then you become a better. Vaccine cost is a hitch in some way, but even I will say, even if you explain to the patient in a proper manner that this protection from these diseases which are preventable are not, they are cost effective. Of course, I will not ask a labor person to take a meningococcal vaccine, but yes, if vaccines become cheaper available, I will say that all vaccine preventable diseases you must vaccinate.
Okay. Before Dr. Jha, before taking you what is your take-home message?
My take-home message is that earlier we used to have only children or the ladies should have the vaccination. But now adult immunization has become a big thing. People are not aware. So this health education to the individuals or the society at large, they should be percolated that adult immunization is very important to have a good health, to avoid morbidity in the future. So that is my take-home message. Adult immunization has to be propagated, and that, as our Dr. Narang said, our vaccinologist, that Amitabh Bachchan is also promoting. Amitabh Bachchan is
Dr. Jha,
promoting this. That is very, very good, and that is the only way one can have this safe life.
Dr. Jha, before ending the session, I would ask one question. Can the subclinical infection give the long-lasting immunity? I will ask the
No,
Dr. Narang also. No.
no, no,
Dr.
it's not.
Narang, what is your opinion?
Yes, any infection, whether it is a subclinical or a full blown, it gives you the right immunity.
Okay.
Immunity, see, during COVID, sir, the children got the disease, they did not manifest any symptom, and they did not have any disease, but still they got immune. So our immunity start from our intradermal dendritic cells. If dendritic cells gives you immunity, no antibodies will come. You only get the protective antibodies, or you call it the neutralizing antibodies. Your innate immunity, adaptive immunity comes second line. The innate and the adaptive immunity producing T cell, B cell, they come from the plasma cells. The initial dendritic cell immunity only gives you neutralizing antibody. Even if it is a subclinical infection, then still you get the antibodies. You get enough antibodies which are able to protect you for certain years. Whether that will long last, the 5 year, 10 year down the line, boosters are required. So boosters are required from your surrounding also. As I said, the cocoon theory is the most important. In that, if the person is immunocompromised, you vaccinate everybody surrounding him. Everybody surrounding maintain a good hygiene. Everybody surrounding maintains proper good, in their way they wear mask and so on.
So hard
So
immunity,
that
you
Thank you,
talking is
Dr.
hard immunity.
Thank you, Dr.
हर्ड
Narang.
इम्यूनिटी सर 95% पे हर्ड इम्यूनिटी. आज एचपीवी वैक्सीन यूके में 2 डोज से 1 डोज हो गया है. न्यूमोकॉकल 4 डोज से 2 डोज हो गया है. दैट इज बिकॉज
Herd
द
immunity.
coverage is 95%. Herd immunity never comes below 80%.
Okay.
It will only come beyond 80-90%.
Yes. Thank you, Dr. Narang. So, vaccination, the individual vaccination is not important, but the vaccination is important. Mass vaccination is important, I think.
Yeah.
That is the message from my side. So, thank you very much, all the panelists. I would like to thank all of you. And now I hand over the mic to Sahili ji, organizer, for the vote of the thanks. Sahili ji, organizer.
Thank you, sir. Thank you so much. And sir, thank you so much to all the panelists here for discussion and making our viewers have such an enlightened discussion today, such an important topic. And sir, your views that you have shared, thank you so much for your PPT presentation that you shared with us. And sir, I would like to thank all our viewers for their participation that they have shown for staying tuned with us throughout the discussion. And I would like to thank all our panelists. Special thanks to Chabra sir for taking out this valuable time and moderation the session make a big hit. Thank you so much, sir. So with this, you would conclude the session. Before concluding, I would like to ask everyone for the last concluding remarks.
Dr. Chhabra,
But last one, I would like to thank the audience or the viewers. First of all, I have given Dr. Jha. You want to say something in the last?
yes, I thank Dr. Chhabra, Madam
The organizer. Thank you.
and all the
Thank you,
viewers.
Saili. Thank you very much.
Thank you so much, sir. Thanks to all.
Okay. Now we are leaving. Okay. Thank you.